Hey guys, it's Dr. Steve from Elevate Sport and Spine, and I want to make a video to talk to you today about how neck pain can be influenced by shoulder position. The shoulder is kind of an interesting joint in that it only has one kind of true bone-to-bone joint where it holds our whole upper extremity onto the rest of our body, and that's here where the clavicle and the sternum meet, or the sternoclavicular joint. Every other joint that we have that kind of holds our shoulder blade onto our body and allows us to move around is more of a functional joint, which means that it is controlled mostly by muscles and things like that. The main muscles that are kind of influencers as far as neck pain goes are this kind of upper trapezius muscle here, this rhomboid, and this levator scapulae muscle here. So when these three muscles are working to kind of hold our shoulder up primarily, and we see this a lot in kind of postural dysfunction where people's shoulder blade kind of comes up and forward, these three muscles are the ones that are doing most of that work. And the problem here lies is that where they attach is kind of here in the neck. So this rhomboid muscle attaches to kind of the lower part of the neck. This upper trapezius muscle has a lot of influence on the middle part of the neck, and the levator scapulae has influence more on the upper part of the neck and the base of the skull. So if they are pulling on things a little bit weird, or they're overly tight, then they're going to make it hard for us to move. Our neck will be stiff, it'll be sore and painful. So what we can do is use a trick called reciprocal inhibition, where we use the muscles that oppose these in a contraction that will help relax them. And the muscle that kind of opposes these groups, which cause kind of upward and inward movement, are these muscles down in here, part of your lat, and then another muscle that wraps around into the front, which is called serratus anterior. And serratus anterior's job is to take the very tip part of this shoulder blade here and kind of mash it against your rib cage and keep what we call winging from happening, which is where the tip of that shoulder blade kind of comes away from the rib cage, which is also kind of mitigated by this movement up here. So as the shoulder blade kind of slides up and forward, and we're using these guys a whole lot, that's when these muscles kind of down here get inhibited. And after a time, we start to get more pressure and things on the neck from that. So what we can do instead is kind of simply try to contract this serratus anterior, this lat muscle, by doing kind of contractions here this way. So we want to try and drop the shoulder blade down and scoop that last little bit of the shoulder blade against our rib cage and squeeze there and hold. And you should feel like it's kind of lengthening these muscles in through here versus just kind of trying to stretch them as much as we possibly can. Because usually the problem comes is that we are stabilizing the shoulder primarily up here versus using these muscles down here to kind of balance that out a little bit more. So hopefully that gives you a little bit of insight into how your shoulder position might influence your neck pain, and what one kind of simple-ish thing you can do about it is, if you want to know more about reciprocal inhibition, I made another video a long time ago. It's back in the archives there, and you can check that out and kind of learn how we apply that situation specifically to this shoulder and neck relationship. So hopefully that answers some questions for you. If you have any others, please reach out to me here at the office. I'm happy to answer or clear anything up for you. Until next time, we'll see you then. Take care.